All righty. Happy Thursday Night Live. Today we have a very special guest with us today. Our topic is a biological dentist approach to airway, not another Band-Aid solution. Dr. Ingo Mahn, thank you for being with us today.
Thanks for having me on.
All right, I'm going to go ahead and read your bio. So introducing Dr. Ingo Mahn, who has over 40 years of clinical experience in dentistry, founding Integrative Dental Solutions in 1989 and later opening Natural Dental Partners in 2017. A 1985 graduate of Marquette University School of Dentistry, he's an accredited member of the International Academy of Oral Medicine, and Toxicology, and holds a doctorate in Integrative Medicine from Capital University. Now, as the founder of Advanced Airway Solutions, Dr. Mahn focuses exclusively on treating airway and sleep disorders. He actively speaks on podcasts and stages across the U.S., advocating for the critical role of breathing and sleep in overall health. It is an honor to have you on our stage. You're welcome to share your screen.
All right.
We cannot wait for this presentation.
Go.
If you click on the bottom on share, there's a green button.
There's the big green button. All right, there we go.
And then choose your presentation. And for those listening right now, Foundations of Orofacial Myofunctional Therapy starts August 1st. So if you're a dentist, a hygienist, a speech pathologist, PT or OT, and you'd like to learn more about myofunctional therapy, join our intro course. Starts on August 1st. All right, we can see some beautiful teeth.
All right, that is actually not quite the slide I wanted to go to. You caught me a little bit here. So let me go to my very first slide and make things a little bit easier.
Okay.
Here we go. So there we go. That's the
perfect. We are ready. I'm going to turn my camera and my mic off so I'm not a distraction, and I'll come back whenever you finish. Thank you. All
right. Well, thanks for having me on. I really am excited to share this information, and especially with this particular group that I'm a member of and is very like-minded with what I've been trying to do in my practice. So I want to share a little bit kind of how I got here and part of my journey and how we assess our patients, and then also talk about the actual treatment of what we do. So I kind of started with this just because, in case you're wondering how I ended up with a name like Ingo, I did grow up in Germany till the age of 12, and I came here in 7th grade not speaking English. So if I sound a little goofy sometimes, you'll have to cut me a little slack. But I did go to Marquette University. I went both to undergrad and dental school there. And, even early on, I was always kind of a continuing education junkie. I was always looking for a better way to do things. And I always wanted to, and once I learned about a better way to do things, I always wanted to bring that back to my practice. So I did a lot of stuff with, Dawson and Christensen, CEREC doctors, LVI, and spent a lot of time down here at Spear, which is actually one of the reasons why I ended up down here in Arizona. So I was always an early adopter. It was the first CEREC user and cone beam user all the way back in 1995. And then I started going down that path of more health-centered dentistry, and that's what led me to found Integrative Dental Solutions. And I also wanted to learn more just because I was starting to realize just how important dentistry in the oral cavity is to our overall health. So I did a doctorate in integrative medicine, not to, practice that, but to just better understand my patients and better understand and communicate with referring doctors. So I moved down here to Arizona to kind of semi-retire or retire from dentistry, realized that was not in the cards for me. I just really do enjoy practicing dentistry. So I founded Natural Dental Partners down here, and then have been doing an airway only practice since 2022. And in 23, we moved to North Scottsdale, and I got to build, I guess, kind of I called my Disneyland of dental practices. And it really gave me the opportunity to kind of build that from the ground up and build a very state-of-the-art practice, but also gave me the opportunity to include practitioners like physical therapists and a speech language pathologist that work directly out of our practice. And this is one of the places where we take all of our airway records. And it's a very, you realize that having an airway practice is a very it's not just something you can kind of haphazardly do. It really does take a lot of organization. So we have I have an airway assistant that helps me with all of those things and is dedicated just to the airway portion of our practice. So I did find that, implementing this really was a challenge. Even if you put all of your effort into it, it does take you out of your comfort zone. And I wasn't, exactly being an early adopter of many technologies. I don't mind being taken out of my comfort zone and spending the money for the training. But what really bothered me was that most of these treatments just didn't address the root cause of the problem. Everything was just more of a Band-Aid approach, and it could actually cause problems. And then when I went to all of these courses, and I did spend probably a good 7 or 8 years before I implemented an airway program in my practice, you just get this clinical information overload. And so one of my first mentors was Dr. Jeff Rouse, and I watched him when he first started lecturing in San Antonio, and then he moved, of course, down here to Spear in North Scottsdale. And so I took all of the courses at Spear. I did their clinical stuff, and I just found that, again, it was a lot of information. It was very complex, and it just never got implemented in the practice. I dabbled a little bit with Vivos, and then did quite a bit of studying with Dr. Felix Liao, and I really liked his program, again, very much based on all of the health and the underlying issues that lead to airway problems. And you may recognize Dr. Liao's name from his book, 6-Foot Tiger, 3-Foot Cage. So that appliance also was, all of these appliances just didn't really seem to ultimately address the problem. And some of them were bulky. Some of them required to be worn 16 hours a day, even this face mask for adults. And, it was just like, for the most part, our patients are very compliant, but when I told them they had to wear this, they weren't too excited about that. So eventually someone convinced me to go see Dr. Tim Adams' lecture. And when I first saw his presentation, it just completely blew me away. Everything that I had learned in my integrative medicine and all of my years in dentistry, all of a sudden the airway piece of the puzzle just seemed to tie everything together. And so he's the first one that taught me about the homeo block. And even that appliance has a lot of shortcomings. It does do a lot, but I really now have kind of expanded it to be part of an overall protocol. And of course, anybody out there treating, sleep and airway issues does realize that treating those issues is not just here's the magic appliance. So here's a question I always ask dentists. I say, how many of you are screening for oral cancer in your practice? And of course, every hand is going to go up when you ask that question. But if you look at the research, 11 out of 100,000 people are going to develop oral cancer. That means if you have a practice of 5,000 people, it means you're going to have half an oral cancer patient. So the numbers, even though they're very low, we still put a lot of importance on it because we don't want to miss even that one oral cancer patient. Well, when I ask another question, say, well, how many of you are screening for airway in your practice? Almost all of the hands go down. And Howard Ferrangis did a survey in Dental Town magazine. It kind of shows that same thing, that a majority of dentists still are not screening for sleep and breathing issues in their practice. And if you look at this study and this was done in the Lancet Journal of Respiratory Medicine, and this was 10 years ago, 25% of women, 40% of men suffer from moderate to severe sleep disorder breathing. And that's already a large percentage. And when I show you what happens even in patients who suffer from mild sleep disorder breathing, that number is even significantly higher. So there's a very large population of people in our practice that suffer from this. And that's why I want to talk about today, not just kind of the problem and how we got here, but the importance of treating these, how we recognize and diagnose them in our practice, and then ultimately, how do we treat the root cause? So the first thing I always, say is that as dentists, we really want to stay away from that term of treating sleep apnea. That's really something that only a board-certified sleep physician can diagnose and treat sleep apnea. So I like to say that we treat the oral contributions to an impaired airway. And I think that makes, dentists for the most part feel a lot more comfortable that we're staying more within the scope of our practice. Because, it does, you're going to get those questions like, why are you as a dentist or as any kind of practitioner treating sleep apnea? And so we really have this spectrum, and there's a lot of people that we can treat without having to wait until they get to be full-blown sleep apnea patients. So right now, there really is a lot more awareness and demand for this. You're seeing people like Joe Rogan and Andrew Huberman and Gary Brecka and some of these leaders that are all over social media talking about these airway issues. You also have people with wearable devices that's making it much easier for them to be aware of these issues. Even you see of course, the Oura Ring and Fitbits and Garmin and even Apple Watches are going to make people aware, hey, there may be an issue with your sleep, something they wouldn't have known about before. So we have these practices full of potential patients, and they're really desperate for our help. I mean, they have nobody else to turn to talk about these things. Most dentists aren't aware of these things. Certainly physicians, pretty much believe that they think anything north of the neck is the purview of dentists or ear, nose, and throat specialists. So when you start having conversations about this with people, they really do kind of open up and say, wow, nobody's ever asked me about this. And, when you do see all of the consequences of sleep disordered breathing, you really do have to ask yourself, how can we ignore this condition? And so I wrote a little booklet, and I kind of came up with this little thought in my head about, they have a food pyramid. I go, what about a health pyramid? Everybody's looking at different supplements and therapies and whatever else they're doing, but how many people are really looking at sleep and breathing and oxygen? And to me, that really is the very foundation of our health. And yet that's probably one of the most ignored aspects of our health. So, some of the consequences of sleep disordered breathing: hypertension, anxiety, depression, immune function, diabetes, loss of libido, adrenal fatigue. That's something that we see in our practices all the time. And this was really probably one of the things that really got me interested initially, being already kind of very holistically minded, was a statement that Dr. Jeff Rouse made. And he said, when I see a patient with a problematic health history, my reaction is, show me this is not an airway issue. And so as I started digging into this, and as I started doing more speaking, I wanted to kind of research that, for myself. And when you put in sleep disordered breathing and pretty much the condition of your choice, you're going to come up with a connection to almost every single medical condition can have a sleep component to it. In our practice, we see a fair number of fibromyalgia patients, and they used to think that, well, people were in pain, they were aching, so they had poor sleep as a result of that. Well, it actually turns out that it could be the opposite. They actually found that sleep preceded pain and sleep predicted pain. So it's actually the fact that they did a study where they deprived, I think it was right around 1,000 women of deep sleep. And after 3 days, they started to exhibit all of the symptoms of fibromyalgia. Depression, this is a big one. I mean, we know that antidepressants are one of the highest number of prescriptions written in this country. And in this study, they talked about how those patients can present with very similar symptoms that cross over between obstructive sleep apnea and depression, and that doctors should be very careful to be sure that they understand the underlying cause. Because here's the thing, that using treatments like antidepressants can, in fact, make the sleep worse, which makes, in turn, the depression worse. So again, it's one of those vicious cycles that I see a lot with a number of these conditions. Same thing with immune function. You think that's, something that's on people's radar these days, with all of the, who knows, when the next pandemic is coming. So everybody is concerned about their immune function. And again, it shows all the studies showing that obstructive sleep apnea does have an impact on immune function. Same thing with hypertension. Proper nasal breathing. We know the importance of nitric oxide, that it's a vasodilator, that it facilitates the transport of oxygen from the blood cells into the cells. And it also has antibacterial and antiviral properties. So very, very important to know about nitric oxide. I did just see Nathan Bryan lecture at one of our IAOMT meetings in Salt Lake City earlier this year, and really a fascinating lecture. He does have a great webinar that he does, and if you Google full script Nathan Bryan nitric oxide, this will pop up, and he does a really good job of really digging into. It's about an hour, and he has some really great information in there. Diabetes. I mean, snoring is associated with the development of diabetes. We kind of joke about snoring, but when you look at what's really happening, it's very significant. Obesity. I get a lot of women in my practice that, they're coming in, they're saying, if you saw what I ate and what I did, I should be, the weight should be dropping off of me. And instead, I'm really struggling. Well, it turns out there's all kinds of mechanisms that relate poor sleep and weight gain. They've done studies showing that poor sleep leads to poor food choices. It affects leptin and ghrelin, which are appetite control and suppressing and stimulating hormones. It results in high cortisol, and just the improper breathing can result in weight gain, not from fat, but from essentially the difference in the weight between CO2 and oxygen. And so we really need to look at the whole spectrum of sleep disorder breathing, because I think one of the problems is that, medicine in general, they're looking for that middle-aged, overweight guy with a neck like a NFL linebacker, and at least to some degree, the problem is recognized and they have a chance to get some sort of treatment. But when you look at milder conditions, especially one that women suffer from, UARS, upper airway resistance syndrome, I mean, we call that the disease of young, fit females. And this group of patients is just grossly underdiagnosed, because a lot of the conditions that they have, the connection to sleep is never made. And so it's really that resistance that's critical, because that increased effort to breathe results in increased cortisol, increased inflammation. And I love this slide. This is I think this picture won the National Geographic Picture of the Year. Well, it's this little Arctic marmot about to get eaten by an Arctic fox. And the problem with our autonomic nervous system is that it doesn't differentiate between a collapsing airway and you about to get eaten. So restricted airflow still causes your autonomic nervous system to respond very violently, because essentially your body's just trying to figure out how to survive the next 5 minutes. So from an evolutionary standpoint, we were not meant to be in that fight or flight situation, all night long. And just want you to notice the great Photoshop on how I turned that little marmot into a upper airway resistance patient.
That's great.
But that's what's going on. And you look at what happens when we're in that sympathetic fight or flight. Everything other than that survival mechanism shuts down. Digestion, reproduction, regeneration. Again, our bodies are just trying to figure out how do I survive those next couple minutes. So as a dental professional, I'm really fortunate, because I really feel that the dental office is kind of the front line for diagnosing and recognizing these issues. And we do have a luxury that very few doctors have, the fact that we get to see our patients a couple times a year, kind of regardless of what's going on with them. And that's where we get a chance to see all of these signs and symptoms and also correlate it to their health history. And our hygienists have the chance, they have their undivided attention for the better part of an hour. So this really is a good opportunity to talk to patients about that. And so we do that by just kind of looking in our mouths and seeing what's going on, and most importantly, kind of asking, why. So the clenching and grinding, we now know, is not just a stress/bite issue, that for the most part, it's our patients trying to keep their collapsing airways open. So we see, of course, looking in their mouths, we see all the signs of that. I see a lot of women, I look at an x-ray and I see the fact that they have a missing tooth and a couple of root canals and 3 or 4 crowns, and all of their tissues are healthy, their bone level is good. And when you talk to them, they're like, yeah, I've always taken good care of my teeth. Well, how did they end up in a place where they had all of these dental issues? Well, it's really interesting. There's a device, I used this at one of the conferences. It was a 2-day conference and they let us use this. This is called the Gem Pro, and it measures biting forces during your sleep. And so one of the last things you do right before you go to sleep is you bite down as hard as you can, and it measures that force. Well, it turns out the forces at night, when you get into deep sleep, there's a feedback loop that turns off. The biting forces can be 3 to 4 to 5 times as much as the maximum biting force during the day. And so all of those cases where I looked at patients and go, how the heck did you break that? Well, now in retrospect, I realized that probably a lot of those patients were airway patients that were just clenching with forces that were much, much higher than what we as dentists would think people normally put on their teeth. Crowded teeth, V-shaped arches, vaulted palates. So we're kind of looking at the structural things going on. Again, I'm always asking, why? Why are the teeth crowded? There's a reason. And that's, I think, sometimes what orthodontics has missed when they're just wanting to align the teeth for aesthetic purposes, not realizing that that little orthodontist that lives, between our teeth in the mandible is the world's most active orthodontist. And if it's not doing its job, that's how we end up with the crowding. And so there's a reason why when kids don't wear their retainers, that the teeth get moved back. It's the muscles doing that. So we look at all of the structural things, scallop tongue, TMJ pain. Obviously, again, that's a very multifaceted problem, but we do look on our imaging to see if there are any issues. But when you look at those forces that patients are putting on their teeth at night, that can definitely result in some TMJ issues, especially when you're also combine that with an underdeveloped maxilla and an trapped mandible. And of course, we look at tongue ties and things like Mallampati score. So these are all of the things that we're constantly looking for. And this is really a great little form. We don't, when we talk to patients, maybe one of the worst things you can say is, hey, I think you have sleep apnea. And they're going to kind of like recoil and go, no, that's not me. That's that old fat guy over here. But when you start asking these questions about, how many times at night you get up to go to the bathroom? How do you feel when you wake up in the morning? How, are you having neck and back pain? So you start kind of building a picture when you're seeing all of these different oral signs, the fact that they're mouth breathing, they're waking up gasping, they know they're clenching and grinding their teeth because they're waking up with morning headaches, they have crowding. So all of these things, we start kind of what we call connecting the dots. And when you start having just these conversations with patients, they're kind of, you can just kind of see the light bulbs go on and they're like, yeah, you know what, this actually makes a lot of sense. So that really does help increase the awareness. And what we really want to do is we want to find out what are their main concerns, what are their pain points. And so that's what we're trying to do. So, the question is like, how did we even get to the point where all of our jaws where we're having all of these issues? And it really starts pretty early, and probably be with this group, I'm especially preaching to the choir. You know, one of the my early influences when I started getting into holistic, of course, is, you know, someone like Weston A. Price, and you know, he started talking about all of those things. But I think even he kind of focused more on the nutritional benefits versus really the functional benefits of breastfeeding. And, you know, I mean, orthodontists have to some degree known about this. This was from the journal Functional Orthodontics back in 2001, and they were talking about the true. They were talking basically how breastfeeding is early preventive functional jaw orthopedics, because breastfeeding forces impact the jaws during the very rapid period of infant jaw growth. And so here, breast suckling aids proper development of the jaws, which form the gateway to the human airway. So really, the mechanics of breastfeeding, and when, you know, doctors, I know there's a period of time when they were telling mothers, you know, it's bottle feeding is just as good as breastfeeding or better. Well, I consider that maybe the dumbest statement of all time in medical history, because it really, that process that's happening at the beginning of a child's life really sets the stage for their health for the rest of their life. So, you know, now we're again battling things like the lack of nutrition in food, but it's really comes down not just the nutritional content of the food, but also the consistency of the food. And that's something that we don't always think about. And then we also have foods that are much more allergenic now. So you have a lot of these kids that are stuffed up, that have a tough time with nasal breathing. You know, they're already underdeveloped, and now you throw in allergy causing foods, it really creates a problem for these kids. So how do I kind of, as a holistic dentist, you know, address the problem? Well, I always thought in all the years that I studied this, you know, that it was all about the mandible, but it actually turns out that in most cases, the problem is an underdeveloped maxilla. And that was when I first started studying the homeo block and studying, you know, with Dr. Liao. That was the first time I'd ever heard about that. I must have spent at least 7 years going to all different conferences and seminars, and nobody ever talked about the maxilla. And then I read James Nestor's book, Breath, and I would imagine probably a lot of you have read this book, but I was really mad when I read this book. I said, really? I just went to all these conferences, traveling all over, and I read this book written by essentially a journalist who's the first guy to really ask the same question that I did, which is, why are we here? You know, he was asking, why do all these kids need orthodontics now? Why do we all not have room for our third molars? And certainly our teeth haven't gotten bigger, so why are our jaws getting smaller? And he uses this slide, and that's something, once you start studying these things and you start recognizing the signs, you know, now all of a sudden you're seeing that in children these days, this is a much more common profile that we're seeing. And so when you get that underdeveloped maxilla, which causes the mandible to become entrapped and retruded, you know, we get the crowded teeth, we get the deficient nasal cavity, the symptomatic joints, and ultimately that constricted airway. So, you know, it kind of drives my family crazy because I'm at the airport. I'm always pointing out airway patients. I watched some Formula One. Unfortunately, this driver did not do very well. But I'm like, you know, I'm looking again. Like, look, he needs to develop his jaw. He needs a homeo block. He'd probably still be driving if I had sent him one. But that's the problem in society, that our jaws are shrinking. And Don Enloe showed in his studies that the size of the airway is directly related to the width of the gonial angles and the height of the symphysis. So that's, if you look at our jaws now compared to 400 years ago, we just have significantly less room for our tongues, and as a result, they're being forced backward into the airway. So, of course, the gold standard, and this is something that we document and tell our patients, you know, the gold standard for sleep apnea treatment is still the CPAP, and of course, we know the reaction patients have in general to CPAPs. I think I've only had 1 or 2 people in all my time that said, hey, I actually like my CPAP. The most of them are desperately trying to figure out how to get off the thing. And of course, in dentistry, we do have a solution. We make them a mandibular advancement device. And of course, that works just by essentially holding the jaw and tongue forward. And it's a very, in a lot of ways, it's of course a very effective appliance. It's saved a lot of patients, probably lives, and it is a great tool. But one of the things I didn't like about it is that ultimately it doesn't treat and solve the problem, and it also had the side effects of causing some issues. So one of the things with these appliances is that every morning, so this is something the patient bites into when their jaw is relaxed and normal, and then every morning after sleeping with this mandibular advancement device, now they have to bite into this to get their jaws and their teeth to line up again. Well, what we ended up finding is that after a period of about 12 to 18 months, a lot of patients would start to develop TMJ pain, malocclusions, just basically coming in saying, hey, doc, my teeth don't fit together anymore. I can't get them to fit together. And so now you've got a patient with these side effects that still has the original condition. So, I kind of asked this, how do we fix the root cause of the problem? So the first thing is always, so this is the HomeoBlock. I did want to show you the appliance again. And in just a second, when we talk about the treatment, I'll go into kind of all of the components of the appliance. So first, we always wanted to determine kind of how severe and what's the extent of the problem. And so we use a lot of diagnostic tools. One of the most useful is a large field of view cone beam X-ray. And I use that, a lot of dentists will kind of look at the minimum cross section and use the cone beam to get that information. I use it more to look at other structures that could be having an effect on the condition, because one of the things that we found is that there's actually a limited correlation between the minimum airway cross section and AHI. There's a dentist named Dr. Ken Smith in Dallas. He has a very large sleep practice. He sent 400 cases to a statistician and said, show me a correlation between minimum cross section and AHI, and he said there really wasn't one. And I just had a patient the other day, that last X-ray, I think that patient was around 60 millimeters squared. This patient had a minimum cross section of 606 millimeters squared, which is by far the biggest one I've ever seen, but he had an AHI of 24. So to me, I'm looking at this cone beam scan, not so much for the size, but one of the things I really look at closely is the shape. And I call this shape the fire hose airway. And we know that if the fire hose, when there's pressure, that hose lets a lot of water through. But what happens as soon as that pressure is released, that hose collapses flat, and that's essentially the same thing that happens with the airway. Another thing that I look at on the cone beam is the position of the hyoid bone. So if you draw a line from the bottom of vertebrae C3 to the bottom of the mandible, that's about 80% diagnostic for obstructive sleep apnea. The other thing that we get a lot of information from is a home sleep study. We've used the couple that I've liked using over the years are the watch pad and the sleep image ring. Kind of have gone more to the sleep image ring just because I'm always looking for the very simplest thing I can do that, makes it the least likely that the patient will either screw it up or not do it. So I like the sleep image for that. I also like the reports that it generates, and I'll go over those in just a second, but it's a very nice thing to sit down with a patient, because when they see red, it kind of gets their attention and they want to ask more questions and know why all these little blocks aren't green. But it's super easy. My airway assistant downloads the app for them. And at night when you go to bed, they essentially just slide the ring on and hit the start button. And then that information the next day gets uploaded into my portal, and I can see that sleep study right away. Now with the appliances that we're doing, these epigenetic appliances, which are not covered generally by insurance. We don't need to specifically have that test read by a board certified sleep physician or an ENT in order to get a diagnosis in order to proceed with treatment. But it's a great tool to kind of like maybe screen for blood pressure in the office. You're not making a diagnosis, but it's giving you a lot of information as to any potential problems that could be going on. So this is what the test looks like. Again, medicine tends to look at, okay, what's the AHI? I'm looking at showing patients about their sleep quality and the fragmentation, and I'm looking at things like respiratory disturbances. What's the body doing to try to prevent from becoming a sleep apnea patient? When you show patients things like this, that they stop breathing for 36 seconds and the heart rate went up to 100 beats per minute, it really gets their attention, because look at this patient. She stopped breathing for 36 seconds, yet she only had a couple of those events. So, she's considered by the medical profession more or less normal. Like what's their treatment going to be for a patient like this? It's come back when things get worse. So they have the nice thing about sleep image, and we're always trying to get this in front of and educate as many patients as we can. They have this new sleeve. It's nice because they're only charging $60. If you buy these in quantity, they're only $69, and it includes 3 home sleep tests. And even at the quantity that I buy these tests at, I'm paying between $15 and $20 a test. So the fact that they can, get these rings out that gives them very, very good data for $69 is pretty remarkable. And it's a great way to anybody that we suspect has an issue, we go ahead and we're able to get them a sleep ring and a sleep study done very, very easily. A little bit of an issue with these staying on. We've had to have people kind of tape them on. It's not quite as nice as the ring, but if someone's traveling from a ways, or it's nice because this one, once they buy it, it's assigned to them and they don't have to return it. So the treatment, before we begin, again, with the holistic approach, we're trying to look at all of the possible contributing factors to their problem. So, we're taking imaging. We even take some cephalometric images. We do pharyngometry, where we're checking for collapsibility of the airway. We're taking posture photos, evaluating the tongue, a 3D optical scan, which is essentially like taking impressions, like the dentist used to put the goop in your mouth. We can now take super high resolution optical scans. And it's also a great tool for educating patients, because when you can put that model of their teeth up on a screen and rotate it and show them, it's very useful. And then we compile all of that into a really nice report that they can take with them. And we're also very good about managing expectations. Again, as dentists, I'm not saying I'm going to treat and fix your sleep apnea, but I'm going to really address all of the underlying contributing factors. So what I really found just fascinating about this appliance is, well, number one is that it's a uniblock appliance. So there's one block on one side, and this is a really strange thing for dentists. We tend to want everything to be balanced and matching. And so the thought of having an appliance that has a block only on one side seemed really strange. And I do have to say, for me, it was too until I actually started using it. But what this essentially does is it replaces the missing hard food in the diet. So every time you swallow and you bite down on this, it causes the appliance to flex. There are these flap springs, and there's a small gap underneath there. So as you're biting, the appliance flexes, and these flap springs put light cyclical forces into the teeth, which stimulates the production of stem cells in the periodontal ligament. And then there's also an expansion or development screw. This is the part that always kind of freaks dentists out a little bit, because they're like, you can't get expansion on an adult that, palatal suture is closed. So this expansion screw is actually, and that's why I like to call it a development screw, because it's not designed like in children to create the expansion, because on kids, we're turning that screw and we're essentially stimulating that growth in the palatal suture. This is completely different. So as we're putting these forces into the bone and causing remodeling, we're turning that screw to keep up with the changes that are being created by the appliance in the body. So what's also very cool about that is that essentially the appliance tells us when we're done with treatment. And we tell people, if you turn that screw, and every time you turn it, it's about 250 microns, about a quarter millimeter. We say when you turn the screw and you put the appliance back in, if it feels snug or tight, back it off. And if that happens a couple times, essentially at that point, we're done with the homeoblock part of the treatment. So I like the fact that we as practitioners aren't kind of saying this is where the teeth should be, that we're just stimulating the body to do what it was meant to do. And these appliances have been around for a long time. Some of these were back from the late 1800s and early 1900s. And Dr. Belfour in New York actually is the one that created that first more modern version of that monoblock design. He actually he tells an interesting story about how the appliance was more or less invented. He had a practice on the Upper East Side of Manhattan, so he had all of these performing artists, and he said they would want a new headshot, maybe get their teeth straightened a little bit, but being in the 70s and 80s, we didn't have the clear liners like we had now, and these performing artists didn't want to have the full metal braces put on. So he said, in New York City, you can find anything. So I found this guy who'd been practicing orthodontics for 60 years, and he was using this group of appliances, removable appliances, to straighten teeth. So he says, I started using these appliances, and my patients would come back and say, hey, my makeup artist is telling me my face is changing. My cheekbones are more pronounced. My jawline's more defined. I'm hitting higher notes when I'm singing. And so he goes, I asked this old orthodontist, he's like, hey, do you ever see that? And the guy goes, yeah, I see it all the time, but I really don't care. And Dr. Belfour did think it was interesting. And that's kind of how the homeoblock was born. And then, of course, that basically became the precursor for the DNA appliance, and Dr. Liao's started thriving appliance. But what I like about the original homeoblock, because the other two appliances have moved away from that monoblock design, is it's really all about creating the strain. And Dr. Belfour, among his many sayings, was, without strain, there's no growth. So that's really what we're trying to do. We're trying to put those forces that, we had a diet, a Neolithic man had the diet that had the consistency of beef jerky. Well, again, when we're looking at nutrition now, we're looking at the nutritional value, but how many times do we talk about the consistency of our food? And once we started cooking foods, once we started microwaving, even now, I see people running around here with their green drinks and smoothies, and it's like, yeah, that's good nutritional value, but it's not giving our bodies everything it needs to grow to its fullest potential. And this appliance is essentially an epigenetic appliance, and genetics being your DNA blueprint, epigenetics being how that blueprint is being expressed. And it can be expressed differently depending on the environmental inputs. So that's what we're doing with these appliances. We're essentially creating that strain, and our body is now re-expressing our own DNA more optimally. And we're seeing patients into their 70s and 80s that are turning that expansion screw and getting sometimes 3, 4, 5 millimeters of remodeling in their maxilla, even at that age. So, I know we all remember from high school biology, genotypes and phenotypes. This is out of a Weston A. Price, out of his book. And these were identical twins. One decided he liked candy and the softer foods. He ate the more old style diet, and look at the same genetic blueprint, yet completely different expression of that. So the good thing is we can put those forces in and still get those changes even once we're adults. So the three main mechanisms, that this is really the cool thing about the homeoblock, is that, and I was really excited just about the fact that we could change the maxilla. To me, that was a whole new concept. But besides remodel, and that was something that Dr. Belfour was actually able to show. And in one of was that when you use that unit block appliance, he was using a program called Analyze 14 that was developed by the Mayo Clinic. With this software, you can put in any two scans. You could put in two ultrasounds, two MRIs, two cone beam scans, and he was able to actually show how these appliances grew bone. And in fact, James Nestor went to see Dr. Belfour, and when he got remeasured after a year, he said he grew up the equivalent of about 5 pennies worth of bone. And that's actually made some women come to our office for wanting the homeo block, not for the breathing and sleeping benefits, but they wanted to grow bone in the mid phase. And it does have those aesthetic, that's one of the side benefits, is that it does improve appearance in addition to improving the sleep and breathing. So the other mechanisms that it took me a little longer to understand, because I was just excited about the fact that we could remodel the maxilla, was that it tones the muscles of the airway. And so one of Dr. Belfour's other sayings was the homeo block is like taking your tongue to the gym. So because the appliance forces you to swallow correctly, you're lifting your tongue an extra 4 or 5 millimeters, and that helps tone the genioglossus muscle, which is the main airway dilator muscle. And that was one of the reasons, because when I first started doing these appliances, I'm thinking, okay, this is like, how long is this going to take before people feel better? Well, it turned out that when they would come back for their first check in 2 to 3 weeks, they were coming back saying, oh my gosh, this thing has already changed my life. And I'm thinking, okay, obviously you didn't grow a whole bunch of bone in the last couple of weeks. So the other thing that this appliance does is it helps to downregulate the autonomic nervous system. And that was another one of Dr. Belfour's saying. He's saying, he always said about the homeo block, we're not treating sleep apnea, we're treating autonomic nervous system dysfunction. So, and you just kind of have to think about, what is your body, what are you signaling your body when you're basically simulating chewing on hard food? Essentially, your body's saying, okay, maybe you're not being chased by anything, and now I have to get the body ready for digestion. So it helps just downregulate the autonomic nervous system. It also does stimulate part of the vagus nerve. There's a palatal innervation of the vagus nerve, and so the appliance kind of stimulates that as well. So that, and I tend to be one of those people that whatever I recommend for my patients, if I can do it for myself, I'm going to try to do that. So I had a homeo block made because I wanted to find out, okay, how bad is this thing to wear? I went through orthodontics and had, teeth extracted and just remember that anything that was supposed to be in my mouth or on my face, I didn't do well with it, and I didn't tolerate it well. Well, I put the homeo block in and I go, okay, this is in a weird way has a soothing effect. And and that's what we're trying to do. Is we're trying to, with the homeo block, trying to take that sympathetic marmot and turn it into a chill marmot. But we kind of created these nicknames for the homeo block. I called it the adult pacifier, and my office manager, she calls it the snooze button, because she goes, when I put it in, it's like I feel like I hit the snooze button and I'm off the la la land. And it really does have an interesting calming effect. And what I love about this appliance is, it's all great and good if you have something that's effective, but if it's tedious or uncomfortable for patients to do, it tends to just, get put in a drawer somewhere. So that's what I really like about the homeo block, is our patients are very compliant, and they come back and they say, I love wearing this thing. It's making me feel better. And that's really, again, the facial bones, that's going to take 9 to 12 months. That's about how long we see it taking before they get to the point where, when they turn that key, that they find they've gotten to their maximum remodeling. But those toning those airway muscles, that really only takes a couple of weeks, and kind of found that autonomic nervous system downregulation, when you put that in, you can actually feel your system calming down. So when we do the treatment plan, we essentially determine what's the underdeveloped side. We do that through our imaging, And there's also a program that kind of splits the face and creates a face out of the right and the left side of your face, so you can see which side of the face is underdeveloped. We find out, all of the contributing factors. Again, I really feel strongly that this is just part of a protocol, and it's not, and we really set those expectations that when we give them the appliance, that, okay, this is not the magic bullet that's going to make everything better, but it's going to start addressing all of the contributing factors. So again, potential lifestyle changes. If they have snoring or a mild potty score of 3 or 4, we use the night lace procedure. Initially, I've had this laser for a while, and it really wasn't. And I would include it with some of the airway treatment, but I didn't really feel like I could charge people for it because it was very unpredictable. Well, they came up with a new protocol, the C3, which treats the floor of the mouth, the soft palate, and the top of the tongue. And we found that we've gotten some really, really great results with opening up people's airways with that. Tongue ties, we're always evaluating those. Now we tend to say, kind of let people know about them and plant that seed, because if you initially throw all of these things at them and then you throw in a tongue tie, people get it's a little overwhelming for them. So we just let them know that there's some things going on with that. The HomeoBlock essentially works a little bit like a myofunctional appliance because of how it's forcing the tongue to function. So probably when we're doing that initial treatment planning, that's something that shouldn't be on there at the very beginning of treatment anyway. So we kind of leave it off so that people don't get overwhelmed. And and we do understand that it's all about the tongue. And I'm a big fan of Dr. Zaghi's. I'm sure most of the people on here are either familiar with him or have done most of his courses on here. Another thing that we've just incorporated. So I used to tell patients, okay, when we get to the end of the HomeoBlock treatment, there may be, some little spaces, there may be some malocclusions. I think we should, we just kind of planted the seed about potentially needing clear aligner therapy or orthodontics at the end of treatment. Came across the Pro Monitoring, which is Glidewell Dental Lab's version of Candid Pro. And I was lucky enough to speak with at a conference with Dr. Moralia, and he's the one that kind of blew my mind with what they were able to do with clear aligners now, and limiting the attachments, not doing IPR, really making sure that we're focusing on the airway and the health of the patient, not just aligning a few teeth. And this is kind of cool when you submit your treatment plan and your treatment goals for the orthodontist to look at. They actually let you pick between standard treatment and an airway treatment plan, and these are done not by AI but by airway orthodontists that are specifically trained in that. And so it's kind of nice. You can get these simulations back. I make little videos like this and send them to the patients, but here's a little slider that shows, so this patient would need 22 aligners that are spaced about a week apart or so. So it's very easy to navigate. We can send patient a link to this, but look at the beautiful arch form. I'm going to tip this a little bit so that you can see also the tipping of the molars. So we see a lot of those molars tipped in because of the inadequate tongue function. So that's something that, initially when I studied some of these things, I was kind of told that, well, as you strengthen the tongue and the HomeoBlock can do these things, that the teeth will move in unison. Well, we're finding that there are discrepancies, and being able to include this as part of the treatment is really, really powerful. The cool thing is patients now, all the aligners go directly to the patient. They get this little box that attaches to their smartphone, and they can scan their own teeth about once a week, and the AI will either give them a go or no go. So once the patient starts treatment, they don't even have to come back to the office, and I can monitor all of their scans remotely. Much fewer refinements to do after as well. So it's a great system, and it's been really I'm actually going through it myself. After I did my homeo block, I'm now doing that and finding the benefits to be really useful. So it's really the kind of the perfect adjunct to the benefits that were created by the homeo block. Now we're going in, improving arch form, improving angulation, refining that occlusion. So we tell the patients about the benefit. And so they get really excited about the whole protocol that at the end, it's always nice to feel better. And then if you can throw in also looking better, they include whitening. And so that really has created a lot more patient interest and case acceptance. One thing though is we do work with allergists and ear, nose, and throat specialists. And then the other thing is when I see on that initial sleep study, if I do see either central apneas or I see the AHI at above in that 30 to 35 range, I always say, you've got to get evaluated by a sleep physician. I don't always know exactly what they're going to do from them, but it's really more the legal implications of that. I don't want a patient with a AHI of 60 running around with one of my oral appliances. And if they have a medical event, someone coming back and saying, hey, this patient was really a severe patient. What are you doing treating him with an oral appliance? So again, as a holistic dentist, we're looking at all of these factors, and we'll pretty much, work with a whole number of practitioners. Now, the one of the things I want to quick mention too is that our goal for treatment is, and that's why we ask them about what are your pain points. It's really, we want to make sure that these are getting better. That if initially, the problem of waking up poorly in the morning was a 10, where are you at now? So we're looking to see what kind of improvement are we getting, in addition to just monitoring whether there's any bite changes and, any other issues, as well as if they followed up with all of the other specialists that we referred them to. We want them to be able to do 100% nasal breathing, establish proper tongue position, eliminate all of the cofactors, and then eventually, as part of that, enlarge and tone the airway. And we'll basically work with a whole team of practitioners, pretty much whatever it takes. So we're looking to see who else can contribute to them reaching that goal of being able to breathe optimally and sleep optimally. And I think I won't be able to spend a lot of time on this, but once you open up go down that rabbit hole of airway, you realize very quickly that, in society, we're not good breather till one day we turn into sleep apnea patients, that a lot of these issues do really start very early. So we tried a couple of different things. We tried Healthy Start, had kind of some mixed success with compliance, and we got some good results, but it was kind of a mixed bag. There are other, obviously, companies like MyoBrace and Tooth Pillow. One of the things that I am excited about, and something I've wanted to know about for a long time, and I was fortunate enough just to have dinner with a practitioner who's been doing this for 25 years, is the Alpha appliance. And what I like about it is it works very similarly to the homeo block in that it's a signaling appliance. And it's also going to be something we're going to be able to use on our younger patients, from 3 or 4. And these can be use a little bit of flowable composite, and you can get these things to stay on very well. So yeah, basically we're just trying to, again, create that nice U-shaped arch form. So just want to close with a quote from Steve Carstensen. And he always says, I just want to open airways. And that's kind of my passion too. And that's why I'm excited to be able to speak to you and kind of introduce you to something that you may or may not have heard about, but something that definitely aligns with those of us who are looking to treat the root cause of the problem. I did also, just in case if you know of anybody who wants to learn more, I do a training course for dentists, and it's designed to be a one-day course that it gives them all the tools, kind of almost like a clear aligner workflow, because there's nothing worse than learning about these things and getting excited and then get back to your practice, and there's no good way to implement it and put it into action. So that's it. I'm going to stop sharing my screen, and then I think we're going to take some questions.
Ta-da! Very, very good. Oh my goodness. Thank you
There's
so
some
much.
good stuff in there that was useful.
Yeah, extremely. And thank you so much for being an Airway Circle member. We love when our members actually come speak for us. This is incredible. I am going to ask you a few things that maybe you have already mentioned in the talk. But since these questions go into our social media, you will invite them to come listen to the whole conversation after.
Okay.
So, first question. You emphasize treating root causes over symptoms. Can you explain how epigenetic appliances like the homeoblock address systemic dysfunction rather than just mechanical obstruction?
Well, the homeoblock obviously does treat the root cause because it's remodeling the airway and tone. It's really all about the stability of the airway. So by calming the autonomic nervous system and strengthening those airway dilator muscles, I mean that's really all. That's the problem. So let's look at those things rather than waiting for symptoms to get really bad.
For patients with complex cases like mixed, central, and obstructive sleep apnea, how do you collaborate with ENTs or sleep physicians while maintaining your biological focus?
Well, essentially what we do is we send them there to get the evaluation, to get another pair of eyes on it, because central apnea is a whole different animal. And when you look at like how do you treat central apnea, it's basically it's a neurological problem. The only way to do it is with a mechanical device. The cool thing is, even if they have to do other treatments, like even if it's initially a CPAP, they're able to wear that oral appliance in conjunction with some of the other treatments they're doing. So they're almost using it as a night guard. And we see a lot of our patients that are going, you know what? All of a sudden I'm seeing the pressure on my CPAP going down. And that's exactly what we're looking for. We would never tell a patient stop wearing your CPAP, but we have a lot of patients that come back and say, well, I started taking naps, I felt better. Because they used to have to wear their CPAP even during a nap, and then they'd say, "Geez, I just kind of took myself off the CPAP, and I'm doing great." So we love to hear that, obviously.
Amazing. We were just recently talking also about oral lays and night lays and baby lays, all of these
It's
extra.
all Derek. That's all Derek Nordstrom. I'm sure you're familiar with him, and and his Alpha Plan. So I'm really excited about. I had a doctor, unfortunately, who was supposed to kind of do my kids' airway program, and I've had to take that over. And I just kind of realized, especially working with the myofunctional therapists in our office, that a lot of these appliances do have shortcomings because of the tongue thrust issues, and it's just trying to get a 3 or 4-year-old to wear a habit corrector is not always the easiest thing.
No, it's not. So talk a little bit more about the night lays. It says that it's noted for rapid results. How does this laser therapy complement epigenetic remodeling, and which patients benefit most from combining these approaches?
Yeah, so the ones that I use the night lays on are the ones that both complain of snoring, the ones where I'm seeing poor tongue position, and also some of the milder tongue ties. So it's called the C3 protocol. So we're treating and using two wavelengths. So there's the NEAG, which is a deeper penetrating, like a heating, and then the erbium, which is a fractal laser, which creates almost like microneedling type, like microchannels that promote neocollagenesis and that firming of the tissue. So we start on the floor of the mouth and make kind of a W shape. And so we're really heating that frenulum, and we're trying to get it to about 42 degrees centigrade, because at that temperature you release hyaluronic acid. And then after I hit it with that, I'll do a manual stretch. So I'll just take that and hold it for
Oh,
about 15, 20 seconds. And I've kind of felt that you can almost feel a little bit of a release sometimes.
that's so cool. Have you
Yeah.
guys tried any of these lasers on the face? Because I know that this and they're great for facial
I
stuff
know
too.
people always say, like, why are you just doing my palate? Like, can you do my whole face? And
Yes.
we use PRF, and we do use that laser exactly the same way. It does a beautiful job, and they have a thing called smooth lace and lip lace. So it's really comes from the aesthetic industry, and so they've almost used it for dentistry. But so once we do that W preheating, then there's two spots on each side below the tongue where we're using the erbium. And again, that helps pull the genioglossus muscle forward. And then we treat the soft palate and the pharyngeal pillars kind of the same way. We preheat with the ND egg. And you can see that lifting of the soft palate. And then finally, we do the same thing on the tongue. There's kind of fat pads in there, and at that same temperature where you're releasing hyaluronic, right around that 41, 42, you're actually destroying adipose tissue as well. So
Wow.
we're doing cool sculpt on tongues as well.
Sign me up. But this is awesome. Yeah, this is so beneficial for sleep apnea. Last question. Could you contrast the autonomic nervous system benefits of the homeoblock with traditional MADs, particularly regarding TMJ risks and long-term occlusion changes?
Yeah, well, I don't think the mandibular advancement device has really any effect on the autonomic nervous system. I think if anything, putting an appliance that takes up that much room and puts your jaw into a position where it's not meant to be, if anything, probably moves the needle in the opposite direction. So what was the second part of the question about the?
I moved it. Let's
sorry.
see. Hold on. Particularly regarding TMJ risks and long-term occlusion changes.
Oh yeah. So the nice thing about the homeoblock is because it allows the jaw to come down and forward. And I'm noticing I thought I had 100% overbite. I'm noticing once I wore the homeoblock, my jaw actually wants to be down and forward. So now I'm doing a little of the pro monitoring before I do my kind of reconstruction at the proper bite. But it wasn't until I wore the homeoblock and it allowed my mandible to become unentrapped that I realized where my jaw was even supposed to be. So the nice thing is about the homeoblock, because it also helps tone that genioglossus muscle. Now we don't have to do as much clenching and grinding. And for a lot of our patients, it's actually helped them with the TMJ symptoms.
Oh, that's incredible. I've always wanted to do homeoblock. When I first learned about this world, I learned my first mentor was Dr. Tom Colquitt.
Oh,
yes.
Is he out of Oklahoma City?
He was, yes.
Yeah.
He
Oh,
is
no, is it Colpitts or Colquitt?
Colquitt.
Oh, okay. I'm thinking of somebody else. I'm sorry.
Yes, Tom Colquitt. He is the one that's on the website for Dr. Belfort.
Oh,
Dr.
yeah.
Belfort treated him, and oh my goodness, his results were incredible. His eyes changing. I mean, 3 years, he got like 10 years younger. It was incredible. And I ended up going with the Marpi, but I know that there are a lot of things that I think homeoblock would have helped me more. And I think that I can still do it. I've still considered.
Yeah, you know what? Yeah, I mean, it can benefit anyone. And I always tell people, I say, I want to have as many tools in my toolbox as possible.
Exactly.
And is surgery an option? You know, absolutely. It's just not the first option. So that's all I'm telling patients. It's like, let's try doing something that signals your body to do what it was meant to do. I think that's, I think there's nothing cooler than that.
I know.
And you can always go to, some other interventions after that.
Oh my goodness. I could stay here all day and chat more with you because I have so many personal questions.
Well, come to Scottsdale. We'll make you a homeoblock.
Yay! I love Arizona, so I'll come visit you.
Well, and some of these things we do work with patients remotely because now it's very easy. When I look at, again, I've really tried to simplify that, because putting that block, it doesn't take that much for dentists to figure out, okay, here's the underdeveloped side. And to be honest, it doesn't even matter if you messed it up and you put it on the other side. You're still it's just still the equivalent of chewing hard food. So there's almost no way to mess it up, which I love, foolproof things. Us dentists, we need those. My joke is, it's so easy, even a dentist can do it. But and that's what I'm trying to do with my airway program. I'm trying to make it, unfortunately, a lot of the people teaching this, they're extremely smart, and they almost forget like what it's like when you first, sometimes I'll say something, I go, oh, doesn't everybody know this? And
know this already.
Rod told them the meaning of life or something, like, wow. So we sometimes forget that people, getting into this world, there's a lot of things that we start taking for granted. And that's what really I'm trying to do with my program for dentists. Because you see what it can do, and you're like, I want every dentist to be doing this in their practice.
Tell us a little bit more about your program. How can they get in touch with you? Do you have a date that it starts?
So it's a one-day program, and you can go on my website. Right now, I'm actually doing one a week from today on May 9th in my office in North Scottsdale. And but we do plan on adding on more dates, but it's a very reasonable program. We also have what's called the Homeo Block Experience. So I feel strongly about doing things like this on yourself. So the dentist can send in a scan and a couple pieces of information. And so by 4 o'clock, we're done with the lecture part, and then we do Homeo Block happy hour, insertion happy hour. So it's kind of nice, and then everybody gets their Homeo Block. I have a great airway assistant that goes through all of the verbiage and how we talk to patients. And yeah, it's a lot of fun, and it's so rewarding. Like I said, I was going to retire from dentistry, and now people say, "What are you doing?" I go, "Well, it didn't take." I said, "I'm more excited about what I'm doing than I've ever been in my life." And people coming back saying, "I went to a dozen doctors, and I would have never thought that my dentist was going to be the one that was going to make me feel better." That's mind blowing for dentists to hear, but it's exciting.
It's the truth about all these airway providers out there nowadays. You guys are nonstop learning. I mean, it's incredible the work that we were doing. That's why we're so happy whenever you guys are part of Airway Circle. Join our directory. It is free. It is a resource because patients are trying to find you, and we just want to help them find you. Well, thank you so much. This has been an incredible hour. I really appreciate you. Next week, everybody, May 8th, I think we have Dr. Hank. Dr. Hang, Anne is interviewing him. And then again, don't forget, if you'd like to join our intro course to myofunctional therapy, starts August 1st. Registrations are open and spots are limited. So run, and come hang out with us. Thank you so much, Dr. Ingo.
Thanks for having me on.
Have a wonderful day. Bye-bye.